Alright, today I'm going to be changing a dressing and performing sterile gloving. First, I'm going to provide the patient privacy by closing the curtain and then performing hand hygiene. I've gathered my necessary equipment and supplies such as sterile wound kit, biohazard bag, which is off screen but I'll show it later, sterile glove kit, label, pens, and gloves. I have verified the healthcare provider's orders, which is this patient is going to be receiving a dry dressing. I'm going to introduce myself to the patient and their family, and then I will identify the patient using 2 identifiers and compare those identifiers against the patient's wristband, as well as have the patient state their name and date of birth verbally. I will now assess the patient's pain by asking them to rate their pain on a scale of 0 to 10. I will explain the procedure to my patient and verify that they have agreed to receive this wound treatment. If this wound had a risk of spray, I would apply the proper PPE, which would include gown, gloves, and a mask to avoid exposure, but today I'm just going to need gloves. I'm now going to position my patient comfortably. Right now the patient's completely covered, and I'm going to just expose the area that I'm going to need to be redressing. My patient has been instructed not to touch the wound, nor to touch the sterile supplies being used. Within reach, I have placed a disposable red biohazard bag, which I have right here. The top of the bag has been folded over to make a cuff, and I just have it out of frame for space purposes. I'm now going to apply clean gloves. And now I'm going to remove this dressing. I'm going to pull parallel to the skin where the wound is toward the dressing while holding down the uninjured skin. I'm pulling off the tape in the direction of any hair growth. If it had been necessary to shave the patient, I would have obtained the permission of the patient, and I would have worked within the hospital's policy for that. I will remove the top layer first, being careful to not expose the soiled side out of the patient's sight. I'm going to be examining the exudate on the dressing. I'm going to be discarding again so the patient cannot see the soiled side. I now will take the final dressing off and discard away from the patient. The soiled side is away from the patient. I'm going to actually fold this in half and ball this in my glove and remove my gloves. And now I'm going to perform hand hygiene and re-glove. Well, after I re-glove patiently, ever so patiently, I'm going to inspect the color and integrity of the wound. I'm going to be looking for edema, any exudate, loss of skin integrity, or any foul odors emitting from the wound. I'm going to observe the skin around the wound, and if there were any drainage devices present, I would also observe the skin around that wound. Now I'm going to deglove, discard those, and perform hand hygiene. Alright, now I'm going to exhibit my sterile gloving technique. I have my supplies for the proper size gloves for myself. The package here is intact and dry. I'm going to perform hand hygiene and inspect my nails and hands for any cuts or abrasions. I'm now going to remove the outer wrapper and lay the inner pack on a clean, dry surface, and this is all going to be happening at waist level. I'm going to identify right and left, and then I'm going to open further. Beep. Now I'm going to use my non-dominant hand and grasp the glove of the dominant hand by the cuff, and I'm going to then put it on. Trying to keep the glove cuffed, I'm going to pull it on my hand, keeping the cuff. Yeah, like I said, keeping the cuff, and then I'm going to pull the second glove over my non-dominant hand. Again, trying to keep that cuff present cuff is present. And I'm going to interlock my hands above the waist. Now I'm going to continue with my dressing. I'm going to gently palpate the edges to determine if the pain level has increased and ask again on a scale of 1 to 10 their pain. I'm going to be assessing for drainage or bogginess, and I would measure the wound if it was indicated with the wound measuring system, but it was not indicated for this wound. To remove my sterile gloves, I'm going to go back to finishing up sterile gloving. I'm going to remove my gloves by grasping the outside of one of the cuffs with my other gloved hand, and avoiding to touch the wrist. Pull glove, turn inside out, grab with my gloved hand, and then I have my take fingers from my bare hand and tuck them inside of my other glove. Peel off and turn inside out the other glove. Discard these in my biohazard bag and perform hand hygiene. All right. Now, this is trash. I'm now going to create a sterile field with a sterile drape. I have this sterile drape in my packet, my sterile field package here, and then I'm going to place that on a clean surface. So I'm going to grasp the outer edge, lift without allowing it to touch anything away from me, and I'm going to grab the edges to lay the drape down. A 1 inch border around the sterile field is not a 1 inch border around the sterile field is not sterile. I'm going to add my sterile tray with my supplies to the sterile field, but I'm not going to reach over the sterile field, so I'm going to come around, place my tray. You would not want to reach over the sterile field at any time. I'm going to apply clean gloves. And I'm going to be using sterile forceps because I have decided to use a no-touch technique for this dressing. Oh my gosh, my gloves are failing me. It's okay, patience is a virtue, right? Okay. So I'm going to be creating, I'm going to use cotton balls and an antiseptic swab and forceps, antiseptic, and then I'm going to be using cotton balls. Let me put it on my dominant hand. I'm going to have cotton balls here. I'm going to dip it in this antiseptic solution and clean this area from the least contaminated to the most contaminated. 1 stroke at a time. Cotton balls should only be used once. Beep, beep, each time. Dipping it in that antiseptic solution. If the patient had a drain, instead of doing like this 1 stroke process, I'd be doing circular motions. And I'd be using an aseptic technique. Last cotton ball here. Beep, beep, beep. Clean. All right, now I'm going to use dry gauze. Again, forceps. I'm going to be using dry gauze to plot dry this beautiful wound here. Dispose of that. And I would do that for a drain as well if the patient had a drain. This was antiseptic ointment was not ordered for this patient, so I won't be using any antiseptic ointment. And now I'm going to apply the first loose gauze contact layer. If I can grab gauze out of here, there we go. Gauze contact layer. It's looking good. And then I'm going to apply a thick woven pad. If this was a drain that I was covering, I'd be using 4x4 cut gauze specifically. Got my thick pad on there. All right. And now I'm going to secure the dressing with tape. I'm applying this perpendicular to the wound. This tape is not cooperating, so don't worry. Backup tape. Don't you worry. Okay. This tape is sticky. My backup tape is stickier than my primary tape, but never fear. Nurses don't crumble under pressure, right? Okay. What was I doing? Oh yeah, perpendicular tape. Let me try this. Yeah, that works 10,000 times better than what I was doing before. And maybe it was an overestimate. All right, and now I'm gonna label the dressing. Here's my pen. I'm gonna label this dressing with the time, the date, and my initials. Now I'm going to remove my gloves and perform hand hygiene. Boop, boop, boop. Then I'm going to reapply clean gloves and dispose of my supplies. And my biohazard bag. Now I'm going to remove my gloves. And I'm going to recover the patient. I'm going to help the patient into a comfortable position, placing any toiletries, personal supplies, and the call bell within reach. I'm going to also make sure they understand how to use the call bell to get help from me. I'm going to raise the side rails ×2, lower the bed to its lowest position, and perform hand hygiene for the final time in this room right now. And then I'm going to document and report the patient's response and any expected or unexpected outcomes. Thanks for watching.